think there's a couple people here now. Not that I can see anyone. Okay. All right, so I think we can probably get started. Apologies for running a little bit late today, and we were having a couple technical issues. But for those of you who don't know who I am, my name is Dr. Simi. I am Head of Business Development at GlycanAge, but also a medical doctor in background. So just for a bit of context, so I used to work in acute medicine in the UK and then made the switch over to GlycanAge, mainly because I was looking for a more something that focused more on preventative care as opposed to disease care, which I'm sure many of you understand and resonate with. So the aim of today's session is to give you some information about the human glycome and give some facts about the power of the human glycome in particular. It would be great to actually know if you guys would put in the chat who here is already using GlycanAge in practice. Let's see if we get any responses. Can't quite see the responses, but I will crack on. So as I said, the aim of today's session is to do a couple of things. So what we want to do is understand what the glycome is and how it contributes to biological aging, understand the benefits of GlycanAge in managing, monitoring, and measuring the individual effects of interventions on patients. But also we want to know how to deliver and interpret GlycanAge results, both considering the psychological impact, because we do know that sometimes getting the GlycanAge can, for some patients, especially if they're a lot older than they expect to be, can be a little bit daunting, but also understanding how do the indexes actually apply to practice and how do you use them in practice, as well as disease associations, recommendations for further testing and treatment, and then knowing some of the common challenges that can come with interpreting GlycanAge. So unless there are any questions, I will swiftly move on. So I guess the first thing...
Just a quick note to add that I'm trying to enable the chat for everyone, but currently no one is able to send any messages. So you can start with your presentation and I will figure this out soon. Okay, sure, no worries. Hopefully you guys will be able to interact a bit better in the chat in just a moment. Apologies for that. If anyone does have any questions, just hold them, and once the chat is enabled, hopefully you can share with us. So I guess the first thing that we want to understand about GlycanAge is that we have a really big focus on prevention. So as I mentioned, I made the move from traditional healthcare into GlycanAge because for me it was really important that we were looking at prevention as opposed to disease care. And I think one of the key problems we know exists within healthcare is that it is largely disease focused. Conventional medicine is designed around a one-size-fits-all model, basically meaning that everyone typically has the same treatment. And we know that there's this increasing number of novel therapies that typically and sometimes lack this evidence. And so how do we as practitioners make sure that we are using objective measures to make sure our patients are best looked after, or our clients are best looked after? And so GlycanAge has a solution, which is an evidence-based tool. And I think that's the most important thing. We're talking about using objective evidence to understand, well, to first of all, predict disease up to a decade in advance, which we'll talk about in a moment, but also validate responses to changes so you can actually see if people's treatment plans are valid for them. And then, of course, motivating clients as well. And I think that motivating clients section, that third one, is actually incredibly important because especially depending on the clientele you're working with. So if you are dealing with clients who are in the space where they're actually quite well patients who want to be better, they want to optimize their life, actually having a way to actually track that improvement can be really, really helpful. When we think about disease care, which is maybe what a lot of us are used to, or the traditional way of working, what we know is that actually the difference between being unwell and feeling healthy is quite clear, and people typically feel different. However, when we think about being well and trying to make sure we don't become ill, actually there's not necessarily a relief of symptoms there. And so for those clients, how do we understand, or how can we tell if they really are optimizing themselves? And GlycanAge offers a way to measure that. I'm wondering if we have the chat active yet. Is that? I believe it has been resolved now, yes. But feel free to try, everyone.
Great. So I was asking previously, who actually is using GlycanAge at the moment? If anyone feels confident enough to put it in the chat. Douglas sees the chat. Thank you, Douglas. That's very helpful. Anyone currently using GlycanAge? Okay. Yes, Douglas says he's using GlycanAge. Great. Not Edward. Okay. So we have some people who are using GlycanAge already and some people who are not. So I'll try and tailor it to both groups of people. So I do believe, especially when it comes to GlycanAge results, and we'll talk through the results. It is really helpful when you see it in context. But I think this can still be really useful. And I do invite everyone to sort of ask questions. And do let me know if you have any specific questions that I can answer. This is ideally a bit of an interactive session. So please do send some messages and things like that. So let's just talk a bit about what glycans actually are for those of you who don't already know. So one thing I think is really important is that we make clear is that glycans are not glycation. So people often confuse glycation, which is what we see in HbA1c, in diabetes, with glycans. Glycans are these complex molecules or sugars that sit on the surface of pretty much every cell in our body. And I almost describe them as a niche part of science. I think they're almost like the world's best kept secret. And I say this because there is a whole department of science that is dedicated to this called glycomics. And actually what we know is that as our bodies produce proteins, these proteins go through a series of different changes. One of those changes, one of those post-translational changes is glycosylation. And glycosylation is the process that enables a protein to actually function. So the example I always give is about red blood cells. We all have red blood cells, but our blood type is unique to us. And actually what determines your blood type is the glycans on the surface of your red blood cell. So these are a very important aspect of our biology, and they give us a huge amount of information. And what GlycanAge does is actually exploit that information to understand the level of inflammation happening in the body. And it gives us a lot of indication about actually what is your body's propensity to fight illness, to fight disease, but also the level of inflammation happening as well. So I hope that gives a bit of a broad overview of what these glycans are and how useful they can be. So again, just to really give you a sort of diagrammatic view of that, hopefully you guys can see my mouse, but with the GlycanAge test, what we're looking at specifically is the adaptive immune system. So we look at the glycans on the surface of your IgG, and this is a picture of a glycan just here. And what we know is that actually, as your body is exposed to different levels of chronic inflammation, these glycans on the surface of your IgG, they change. And some of them are associated with pro-inflammatory. So if you're going through a significant systemic inflammation, there's significant systemic inflammation in the body, those glycans will change shape and will change into a more pro-inflammatory version. Whereas if you're anti-inflammatory and you're in an anti-inflammatory state, you have the anti-inflammatory glycans. And so what we're doing with GlycanAge is we're measuring the ratio of those two types of glycans, or the variation of glycans, to understand where you are on the scale of inflammation. I'll just pause there really quickly to see if there are any questions at all. Either post in the chat or in the Q&A, whichever is easier. So we have quite a few people here. Okay, let me crack on. Okay, so as I previously mentioned, we know that your glycome is unique to you, and as I said, the subunits of these glycans change as you're exposed to inflammation, and they help us to understand the level of inflammation happening in your body. And I think it's really important to note that inflammation was recently added as one of the hallmarks of aging. So we know that inflammation is incredibly important. We know it causes chronic disease, and actually what we're trying to do is leverage that information to understand where somebody is in terms of their health. So when we think about other biomarkers and GlycanAge, I think, especially as practitioners or people who are using the test, one thing you really want to understand is actually what's the difference? Why would I use GlycanAge over any other test? And I think with biomarkers, because we're trying to measure and we're trying to understand the information and then interpret it to give valuable advice, what you need is a biomarker that is stable. So what this means to me is, if I test it today and I test it tomorrow and I've not changed anything, it shouldn't change. It should stay the same. And GlycanAge has that. I think what we see in some of the other more traditional biomarkers that we might look at is that unfortunately they can be very unstable and change very quickly, and so it can be difficult to actually interpret them. And similarly, there are other biomarkers that we know can be a bit slower to act, and so again, it's very difficult to interpret them. And actually, we're doing a webinar. The date escapes me. I believe at the end of September, looking specifically at the different biological age clocks and comparing them. So if anyone's interested in that, we'll definitely share that information after this webinar. So this is just again to reiterate, when we think about glycosylation and what GlycanAge measures, it's not glycation, it is not HbA1c, it is not what we see in diabetes. It is a very different process, which is more about complex sugars, which give us a huge amount of information about what's happening in our bodies. So when we think about the GlycanAge test, so many of you would have done the test already, and so for some of you this will be very basic stuff, but just for anyone who hasn't done the test before, so the GlycanAge test is a very simple finger prick blood spot test. It requires 4 spots of blood, and the reason it requires the 4 drops of blood is because we run every single test in triplicates. This is so that we can increase reduce our error margin as much as possible. And so again, this highlights just how stable our test is. And then of course it goes to our lab where analysis occurs, which is a sort of very long 10-step process. And then of course you get the results available on your partner dashboard. In terms of correct processing, I can't highlight this enough, but it's really important that, of course, standard procedure, making sure clients clean their fingers beforehand to make sure there's no contamination. As I mentioned, it's just 1 drop of blood in each circle, and the sample needs to air dry for no more than 6 hours. And then obviously ensure it's sealed properly within the plastic bag that's provided, and that's again to make sure there's no contamination. And then when the samples are sent off, they remain stable for about 2 weeks. So if they get lost in the post, for example, for more than 2 weeks, then we would typically send another test for you to repeat. Now, probably the most interesting part and the part that everyone's sort of waiting for to understand. What I'm going to do is I'm going to talk you through the report, what the report looks like, and the different elements that it's broken down into, and what this actually means in terms of clinical practice. So when your clients receive their GlycanAge, or when you get the client's GlycanAge, the first page or the first thing you'll see is their sort of overall GlycanAge. So what this will show them is the biological age, which is of course based on the glycans versus their chronological age. And so it gives them and the reason we've done it this way is to give an easy way to understand where they are. I think age is probably the one thing that we all understand, and so if you give it to them in that benchmark, it's very easily understandable in terms of where they are on their journey. It's probably important to note that the GlycanAge age can only be a number between 20 and 80, and that's because of the large cohort that we have are between those ages. And it's the number that you get is an overall measure of the background chronic inflammation that contributes to aging. However, that number in and of itself is useful, but actually in order to really understand it, we break it down further into indexes, which give an indication of what might be causing the increased or lower than expected level of inflammation. And I think one thing that typically people ask, when we've been to events and conferences and we've been testing, people are always like, oh, I went drinking yesterday, is this going to affect my GlycanAge? The answer to that is no. Because we're looking at IgG, which has a half-life of 21 days, typically you would need to consistently have a habit of doing something for at least six weeks before you actually see any changes in the GlycanAge. So again, this is just to highlight that stability of this test. It is not something that is affected significantly by acute changes. It's more about chronic changes and things in lifestyle as opposed to singular moments. Just very quickly going to check the chat to see if anyone's asked any questions at all. Great, okay. So as I mentioned, one of the things that we do know with GlycanAge is because GlycanAge is not looking at being, like many tests, it's not looking at being in line with your chronological age. So we're specifically trying to understand actually where are you as compared to your chronological age. And so some people do have quite large deviations from their chronological age, and this can be quite a shock to them. And so I think it's very important to signpost and prime the patient and be very obviously clear when you're breaking that news to them. And one of the key reasons we have GlycanAge is because it's changeable. There is honestly no point in having a test that you can't unfortunately change. And so I think that's a really important thing to remind clients of, especially if you're about to embark on a program with them to help them improve this inflammation, which is how a lot of our partners typically use the test. So as I mentioned, the GlycanAge is broken down into different indexes, and there are 5 of them. So we have Glycan Youth and Glycan Shield. These 2 indexes are indicative of anti-inflammatory. So as I mentioned, when we have glycans, especially on our IgG, on our IgG antibodies, they change in accordance with the inflammation occurring in our body, and they're both effectors, and they're both signs of inflammation. And so actually the Glycan Youth and the Glycan Shield represent the level of glycans you have that are associated with anti-inflammation. The Glycan Mature is pro-inflammatory. So if people have a lot of this, it tends to suggest that they might be in an inflammatory state. And then you have the Glycan Lifestyle Index and also the Glycan Medium, which are more supportive to give information around the results you get. And the way these indexes are calculated is they're actually, what we look at is the different groupings of the glycans that share similar molecular properties, because it's these molecular properties that change as you're exposed to more inflammation. And so these similar properties indicate potential associations with specific disease types, genetic traits, and or lifestyle habits. And towards the end of this presentation, I will show you some newer research that we're doing, which enables people to understand, actually, based on the glycan pattern that someone has, what potential diseases could this person be at high risk of. So I think the key thing here is that the age that you initially get gives you an overview of where someone is on their journey. The indexes break it down to give you information about what might be driving that GlycanAge up or down. And so this is just a sort of, I think, good diagram to understand that changing in shape that I'm talking about. So these glycans that exist on the surface of our antibodies, as I mentioned, they change as we're exposed to disease and inflammation. And this is just a diagram showing as we age, they do naturally change. They naturally change as we lose our resilience and resistance. However, what we do know is that you can change these shapes with lifestyle. You can change them with medication. We see them change with medication. And this is one of the key things that you're tracking when you're doing someone's GlycanAge. So you can give them a huge amount of information about how the interventions they're doing in their lives are actually affecting them from an inflammation point of view. So what I'm going to do now is I'm going to go through each of the indexes, and there's quite a lot of information here. And I think what we can do is, if people are interested in and they do want this information for themselves, we can share this information. This comes actually from a scientific document that we do have available on the dashboard, but it's just broken down to be a bit more digestible. So again, I would really encourage, if anyone has any questions as I move through the slides, please do feel free to put them in the chat, so we can have a sort of interactive conversation as well. So the first glycan index we're going to talk about is Glycan Youth. So as I mentioned, this is one that's specifically associated with anti-inflammation. And the thing that makes it Glycan Youth is that each glycan unit is made up of various different subunits. And actually, as you add galactose to these subunits, they're more indicative of anti-inflammation. And so Glycan Youth is one of the glycans that has these 2 galactose in it, which seems to be very protective in people of inflammation. And so what we know is that when people have a lot of these glycans, a lot of these, youthful glycans, it actually suggests that they're in an anti-inflammatory state. And what we see is that with this index, if it's low, so if someone doesn't have very many of them, typically it suggests that there may be some autoimmune disease going on. Now, it's really important that we recognize when we think about glycans in particular, especially with some of the different kind of clients we might see, some clients will have disease already. So you might have patients who have thyroid conditions, who have adrenal conditions that already are presenting with symptoms and disease. However, you might have clients who their GlycanAge is quite high, a lot higher than their actual age. And for these individuals who are relatively healthy, it's important to kind of try and explore what might be causing that. And so what we encourage all of our partners to do is to try and triangulate some of this information with a history that you would have of the client. And again, this is really helpful if you're doing a program with the client or patient. And so you have some of their history, you understand their family history, and you can use this to triangulate what might be going on. But what we know in particular is when we think about glycan youth, we know that this index particularly is affected by extensive weight loss. So we see this one change a lot when people go through this weight loss process, but also moderate exercise affects this index positively as well. And so when we have clients who have a GlycanAge which is maybe a bit higher than they would want, one of the key things that we try and emphasize doing is actually targeting some of the specific indexes. And what we know is that certain indexes respond to different changes. And a lot of the learning that we're doing at the moment, so we as a company, we're really big on the science and the research and the evidence. And what we're seeing is there are certain indexes which really are affected by different elements. And some of these include supplementation. But in particular, when we think about glycan youth, we know that that is responds very well to some of your lifestyle weight loss and exercise. Do we have any questions at all? No, we're good. Okay. So now I'm going to move on to speaking about the Glycan Shield. So this is another pro-inflammatory one, however, slightly different. So not only do you have those two protective galactose that we spoke about in the Glycan Youth, but you also have the sialic acid as well, which is also very protective as well. And again, this is like your best defense against chronic inflammation. And when we see a high level of these glycans, again, it's something positive. And we do, again, given the fact that it is associated, it's your biggest defense against chronic inflammation. When you see that this index in particular is quite low, it again typically tends to be seen in people who have autoimmune disorders, cardiometabolic disease as well. And it's all about triangulating all these results. And I will talk a bit about how you bring all these results together to understand which directions it could be pointing you in. Sorry, just have a question. Have you a list of supplements that affect GlycanAge? Great question, Edward. So we currently at the moment are actually building what we're coining in the company as a supplement Bible, which looks at all the different supplements that are commonly prescribed or used by individuals and understanding how it can affect the GlycanAge. Now, again, I think one of the challenges about the longevity and wellness space is that some things don't have a huge amount of a huge body of science behind them in terms of, clinical control trials and your gold standard. But what we do have for some of these supplements is anecdotal evidence. And actually over the next couple of weeks, what we're going to be doing is compiling some of the information that we've had from the experience that we have with testing to actually understand which different supplements are improving GlycanAges. So just as an example, we did do a study with a company called Nuchido, which is an NAD supplement. And we did see that there was a reduction in the GlycanAges for those clients who were using NAD for, I believe it was 90 days. And we saw, I think it was a drop of about just under 2 years in their GlycanAges. And so we are seeing that these supplements can be beneficial. But again, we always will encourage that you take this information with caution, because again, we're not doing massive randomized control trials. Unfortunately, the industry is not such that you're going to get massive pharmacy companies spending loads of money on this. However, where we can, we are doing these trials to understand how different supplements affect the GlycanAge. I hope that answers your question. Cool. If anyone does have any other questions, please, as I said, do put them in the chat. So just going back to the Glycan Shield. So again, as I mentioned, this is an index that is associated with health and youthfulness. Having a lot of them is suggestive that the patient is in an anti-inflammatory state, which is of course positive. And the thing that makes this so protective is the sialic acid that we see. Now, just to kind of go back to Edward's question. So there was an animal study where we actually did look at if you were giving supplements, sialation supplements, or sialic acid supplements to, and this was in mice, and you did actually see an improvement in their Glycan Shield. But again, you've got to take it with caution. Is this truly applicable to humans as well? That is something that we don't currently know just yet. Okay. So next one is GlycanMature. So this is an index which we see is quite active, especially in those who do have significant inflammation going on in the body. But we also can see this one change a little bit with elements such as over-exercising. So I'll talk specifically about over-exercising in a minute, but there are different ways that this index can change in particular, but overall we know it's associated with inflammation, and it naturally increases as we get older. And what indicates the glycan mature is when you've lost that protective layer. So you don't have any sialic acid on there, you don't have any of the galactoses, and that is indicative that there is an inflammatory process going on. And as I mentioned, as you're aging, it is normal for this to happen. But when people have it in excess, that's when you'll see them have a significantly higher GlycanAge than their chronological age. And so when do we see this index increase? So as I mentioned, it does increase naturally with chronological age, but it also, we see this really rapidly increase in women when they're entering perimenopause. And so we have a lot of partners actually who are using GlycanAge to help their female clients understand where they are in terms of their cycle. So especially if you have a female who you're testing regularly, and we do actually have a great case study on this. But if you have a female client who you're testing regularly and you see the significant increase in their GlycanAge, what we do know is, especially if they're around that age of menopause, sort of late 40s or early 50s, that this can be indicative of them entering the perimenopause. And I think from my perspective, one of the reasons this is so important is actually because we know if you are a clinician who is using HRT, or you are encouraging HRT or bioidentical HRT, actually it is most useful during the earlier stages of menopause. However, many of you will know that menopause is actually a challenge to diagnose, and many women go through the menopause without even truly understanding where they are until they actually have completed or got to menopause, where, you know, we typically say 12 months without a cycle. And so one of the things that GlycanAge can be useful is to understand where they are on that journey and help them through that with either HRT or with more natural ways of working. And we also see that glycan mature can be very highly associated with things like IBD in particular, but also again, a future risk of metabolic diseases. And so where you have clients who have a family history in particular of any cardiovascular diseases, this is a big signal to have a look at what's going on in the cardiovascular region, and think about doing further testing with these kind of clients. I did see some questions in the chat, so let me just have a look. Okay, great. I think they've been answered. Thanks, Ori. Right, now moving on to the supportive indexes. So these indexes give a bit more information lateral to the actual glycan profile. So and they don't have a direct effect on the overall GlycanAge, but what they can do is give information about where on this, especially in terms of lifestyle, where in the lifestyle bracket are they. So is the lifestyle they're living effective for them, or is it potentially causing damage? And so with glycan lifestyle, we know that this is associated typically with healthy lifestyle choices, and having a low score indicates having a lower score can actually indicate better health. So what we know is that patients that smoke or who have COPD will always, you know, typically have a higher score on this, whereas those who are eating positively, so specifically for diet, this can be a great way to understand how people are doing. And we see this one changes a lot. So again, anecdotal evidence, but we see this one changes a lot with people who are on various supplements. So one of our specialists, who's a nutritionist, did note that a lot of the clients that she was working with who were taking supplements and then retesting were seeing quite significant positive changes to their glycan lifestyle index. And I guess in terms of structure, so you can see the structure there, but ultimately with these glycans, what you see is this bisecting kind of subunit, which seems to have a positive effect on what's happening from an inflammation point of view. And I guess it's worth mentioning, so with clients who have a family history of longevity, so if they have centenarians in their family, for example, or they tend to have family members that live to very sort of older age, again, you're going to see a positive score in their lifestyle index as well. So there is some genetic element to it. And again, I'm very wary that I'm not reading too much into the glycoscience, just because I'm not sure exactly what the appetite is for the science. But as mentioned, we will share these slides. So if you are really interested in this, the deeper science and understanding about the natural killer B cells and how this has an effect on the glycans, again, we will share these slides. And then we have the glycan median. So glycan median is an interesting one because it's almost bidirectional, and it's one of the glycans that you have to kind of look at with the whole picture. So I would never recommend that you just look at the glycan median. I typically would say that you need to look at it in concert with the glycan mature and the glycan youth as well. The way I kind of visualize glycan median in my head is kind of like a seesaw. And if you imagine glycan youth is on one side and glycan mature is on the other side, your glycan median sits literally in the middle. And if you have a really high glycan median with a high glycan mature, so glycan mature being more associated with inflammation, typically that picture, again, is really highly associated with metabolic disease. And so in that case, it can be quite a negative. However, where you have a client who has a really high youth, so a high anti-inflammatory glycan with the median, actually that can be positive and actually not have a negative impact. And so glycan median is one of the ones that you have to look at with a bit more of a critical eye and look at it in context of the whole picture as opposed to just as a singular index. And so we know that this index in particular tends to be affected by genetics. And so I think I have a couple of case studies that I'm going to share with you, but we know that when you have clients who have, like I said, a significantly high median and mature, so more on the inflammatory side, you are going to see there is a higher risk of metabolic syndrome and metabolic diseases. Just see a question. Sorry, just bear with me, just looking at questions in the chat. Okay, I can't seem to see any questions, so I'm hoping that my colleague is answering them for you. Okay, so as I was saying, so what we see is that if you have a low result, it tends to be associated with this risk of developing metabolic conditions in the future, and sometimes it can be associated with irregular cell growth. And when we think about this one, the actionable advice around it is about introducing a lower calorie diet. Weight loss can be helpful for this, as you can imagine. If it's signaling metabolic disease, what we know is that metabolic disease really does respond to weight loss, and advising, and of course increased caution with lifestyle choices, especially because this index is particularly predictive of future cardiovascular disease. In terms of what I said in terms of correlating median and mature, I do have a case study that I would like to sort of share with everyone because I think it's very interesting and gives you an indication of just how you can use those two together. Let's have a look. But before we do that, I think what we do have, as well as that sort of glycan mature and glycan median, is also the glycocardio index. So glycocardio is an extra report. It's only available in women at the moment because women present with these very unique glycans when they have a high cardio risk factor. And so in women who have a high median and high mature, as I mentioned, those are associated with metabolic syndrome, we would typically also offer you the glycocardio index, which would give information about actually what is really going on with the cardiovascular health. And when we do this index, it can just give us information about is this something that is cardio related. And we have seen clients who have done their GlycanAge test. The glycocardio has indicated there's something going on. They've gone and done further testing, and they have been found to have various different cardiovascular diseases. And so it can be really useful in pointing you in the right direction in terms of what might be going on with a client. So I think some of the key points I think is really important to highlight is just some general facts about GlycanAge. So it's a test that can help you understand your client's risk of disease and their level of health resilience. And because of the fact that, it's measuring inflammation, which we know can build up a long time before you actually develop disease. So in one study we did where we were looking at people who eventually developed diabetes over time, what we see is this trend in the glycans. So the glycans really do change way before disease happens. And so it gives us this predictive value and helps us understand that actually if someone is presenting relatively fit and healthy, it is possible that there's still a process of chronic inflammation going on, that if they continue down the line they're going on, it could end up leading to disease. And this is the information that GlycanAge gives you in an objective manner that you can then focus on and adapt and change. What we know is that chronic inflammation is implicated in pretty much all diseases. And so when people do have significantly high chronic inflammation, it isn't something to just be ignored or shrugged off. As I mentioned, it's really important to try and correlate this with some of the information that you have from a history and family history point of view as well. But again, the indexes can be really useful in breaking down what could be causing this and giving you areas to focus on. And then in terms of medication history, so one key thing is to understand is that GlycanAge, because it does look at inflammation happening in the body, and it will respond to both medication as well as lifestyle changes. Many people who are on medication that can modulate GlycanAge will see that, especially things like women who are on HRT, who have been on HRT. We can see that their GlycanAge will be modulated. And actually, one of the things we do see our partners do as well is when they have female clients that they've been working with who go through the menopause, who then start on treatment, you can actually track how well they're responding to treatment by seeing how the GlycanAge changes. And so you might see this uplift when they're going through the menopause, when they enter perimenopause, and then this downwards trend as they start using some of the medication or HRT or various treatments that you might have in practice. And so understanding that is really important because it helps you to just prime the patient in terms of the result. Similarly, if you have clients who are on long-term NSAIDs, so non-steroidal anti-inflammatory medication, or who are on any immunotherapies, of course, this is going to change the GlycanAge as well. Does the last point... So I have someone asking, does the last bullet point imply that drugs may increase the GlycanAge? So there are medications that can modulate your GlycanAge, and some of them can increase your GlycanAge. I mean, there are quite specific examples that could increase your GlycanAge. In my head, I'm trying to think of one off the top of my head, and I'm struggling a little bit. I think let me speak with one of our scientific team, because I'm fairly certain there is a drug that can increase your GlycanAge. I think there's like a couple of them, and I can't remember what they are off the top of my head, but I can get back to you with that information, Bruce. And then we have a question about how often should one retest. So as I mentioned, the half-life of an IgG is 21 days, and so what we see is that you can see changes in glycans within about 6 weeks, but we recommend waiting 3 months before retesting so that you can see the full effect of the change. So if someone is going through an intervention and they maintain the intervention for 3 months, you're going to see them sort of like the best part of their change at a 3-month mark. I hope that answers the question. So as I mentioned, I think I don't know about everyone else here, but I think case studies is probably like one of the best ways to learn and understand. So I'm just going to take you through a couple of case studies to really demonstrate how some of our partners have used GlycanAge in the past to their advantage to help their clients. So this is a history of an 37-year-old female who is active, doing a lot of high intensity running, has relatively good nutrition, but potentially going through perimenopause. Her GlycanAge was 48, so 10 years above her chronological age. And this really highlights the point I was making about really priming your patient before they get the results, so they can understand that this is a changeable result. This is not a fixed thing. So in the consultation, the problem that was identified was that they had elevated chronic inflammation and a high GlycanAge, likely due to the high intensity training and overtraining. And this was the point I was trying to make earlier, which is depending on the clientele that you have, one of the common clients that we see are quite high achieving people, quite people who really care about their bodies and want to look after themselves. I always ask people, how do you know that the things that you're doing? So if, say, for example, someone does intermittent fasting, something that was has been very popular, very publicized, people take on this process of intermittent fasting and they assume that it's going to be amazing for their health. But actually, it is not effective for everybody. For some people, it's actually very bad for them. And, the question I always ask people is, how do you know it's working for you? And they can't typically give me answers. Some people will be like, yeah, I feel amazing. I feel a lot better. But what we know is that for some people, these these practices can work, but for other people, they can be bad, because obviously every single person is individual. And so understanding how different interventions affects people requires an objective way to measure it, and GlycanAge does offer that. So for this lady in particular, who was doing a high amount of high intensity training, potentially overtraining herself, not giving herself enough rest, causing this background level of chronic inflammation within her muscles, this was demonstrated in the GlycanAge. And actually what we saw is that when she shifted her high intensity training to doing a bit of an alternate program where it was high intensity with a couple incorporating some lower intensity stuff going on, actually you see the drop in the GlycanAge. So I'm just going to answer some questions. So as I mentioned, you can really see the change in the GlycanAge as people shift their exercise regimes, their diets as well. And this is a prime example of a lady who does have that sort of higher level of that higher GlycanAge because of adopting a regime that actually wasn't working for her in terms of her nutritional input and the amount of rest she was getting as well. And so, this lady made a decision to shift some of her exercise patterns, but also changed her nutrition profile as well, and saw this continuous change. And I think for a client who you're speaking to, this is incredibly helpful to see. Like, okay, especially when it comes to exercise, right? We're all kind of told that exercise is this amazing thing for us. It's really, really good for us. But actually, it is possible to over-exercise and cause yourself chronic inflammation and do more harm than you're doing good. And this is a prime example of that. In the next case study, this one is a little bit, so this is actually a great way to understand what I was saying about the balance between glycan median and glycan mature. So in this case, we have a 51-year-old female, relatively slim build, normal BMI, ex-smoker, but outside of that has a good diet, pescatarian diet, regularly exercises, past medical history of just a hysterectomy back in 2019. However, there is a family history of this cardiovascular disease. She comes to us and her GlycanAge is 20, which is, of course, amazing. However, a good GlycanAge does not always indicate that there is there's nothing in terms of health. And so even though her GlycanAge was 20, which is the best you can be, her glycan median was slightly off, which is unusual considering she was having her overall GlycanAge was good. And so further investigation was done to understand what was going on and why the glycan median was high. And a decision was made to also get the glycocardia report, which did show, a very poor score. And so she was advised to go for further medical evaluation, where they did an ECG, they did a cardiac echo, a CT angiogram as well, CT angiograph as well. And actually, she did find that she had a calcification in her coronary artery. And so, and this was something that's genetic, something that's been in the family but hasn't been further investigated. And so this, triggered her to go and have these further investigations. And eventually, she was started on the correct profile for her, which of course is, from a traditional medicine point of view, is low dose statin and blood pressure lowering medication as well. And so, yes, she didn't have any intervention. However, she did have some medical interventions that did help lower her risk as well. Okay, and the last one is, I would say, to me anyway, is a very interesting case. It's not something. Sorry, just bear with me. So I have a question. Did that improve her perimenopause? I assume you're speaking about the first case that we referred to. So if I just go back. Is this the question? Is this the case that you're referring to, Edward? Okay, I'll wait for you to respond, and I'll wait for you to respond and then get back to you when you have. Okay, so just carrying on, this case in particular is of interest to me. But ultimately, this was a 90-year-old male who had a GlycanAge of 20, which, as you can imagine, is very unusual. However, they were living a very active lifestyle, daily swimming, mainly vegetarian diet, non-smoker. However, even with that lifestyle, having a GlycanAge of 20 when you're 90 is still quite surprising and still quite shocking. And so the problems identified was that this patient actually had an initial diagnosis of multiple myeloma, which was being treated with a medication cocktail. actually, because of the significant changes that we're seeing in the age, again, it triggered him to change oncologist and sort of correct the diagnosis, which actually ended up being smoldering myeloma, which is basically just a more, I guess, severe in some ways form of disease. And what they saw was that the IgG levels in this patient was very high. And the reason this is an interesting case, or the reason why this is a good illustration of GlycanAge, is because, as hopefully you all know now, GlycanAge does look at IgG. And so if you have something like smoldering multiple myeloma, which increases your IgG level as part of the way it works in its pathology, then of course your GlycanAge is going to be unusual or odd because your IgGs are significantly higher. And therefore, this client, despite being 90, was having a GlycanAge of 20. And so this patient in the end ended up changing a couple of the regimes they were using, changing their medication to help control their disease, which obviously had a positive impact on them. Just going back to the question. Just going back, sorry, I'm just laughing and smiling at something that someone said in the chat, which I completely agree with, which is that there's no such thing as overtraining, just merely under recovery, which I think is very true. But I guess it just depends on one's lifestyle and how well they're, how able they are to recover, and therefore how much training they can do. And then going back to the question that was asked about, did this help with the perimenopause with this lady? If you mean, did it help manage her symptoms? I actually don't have information about if it helped from a symptom point of view. And so the only thing I can say definitely with this case study is that as she was improving her exercise regime and things like that, we did see an improvement. I mean, there is general evidence that says things like improved exercise, especially strength training in particular, can help with women who are going through perimenopause. But in this specific case, I can't be sure that that was the case. Okay, so just the last couple sort of slides here. So I think it's really important if you're using GlycanAge in practice to understand that there are some anomalies and there are some specific cases where you wouldn't want to use GlycanAge. Some of the key areas are surgery. So if you have a client that's had major surgery, or they've had any anesthetic in the last 3 months, then typically we would say wait 3 months before you want to do any GlycanAge testing on them, because it can have a significant effect. With bariatric surgery, so we did do a study on this, and we do find that bariatric surgery, because of the extensive weight loss, does reduce the GlycanAge significantly. And so again, it's all about making sure you're testing at the right time with these clients. Similarly, we do know with anti-inflammatory medication that has been taken for a long period of time, you are going to see a change in your GlycanAge, which of course makes sense because you are ultimately taking this medication to help reduce inflammation. And so when it does that, it is going to show in the GlycanAge. So people who are on things like long-term steroids are going to see typically a lower GlycanAge. However, we have seen it go the other way as well. And again, you see this with hormone replacement therapy as well. If you have clients who, I mean, I've not met anyone who's been having IVIG, so intravenous immunoglobulin treatment therapy, but if you do have clients who are doing this or who are having regular... So I don't know what's happened there. Hopefully that's gone away. Okay, I can hear myself now. So yeah, so I was just saying, with clients who are having blood transfusions, for example, again, you're not going to want to do their GlycanAge because they're getting an influx of new blood components, and therefore their GlycanAge is not going to be accurate. And again, you're going to want to wait 3 months after blood transfusion before you're doing a test again. And then we do know that other medications do affect glycosylation. So I think, Edward, I think you might have asked a question about this, or Bruce, I think you asked a question about this. How do medications affect glycosylation? And I will email you back with the medications that we know can increase your GlycanAge. And then, of course, with disease, so chronic inflammation is in the background of many diseases. And therefore, if you have a chronic inflammatory process going on, it is going to affect your GlycanAge. In this case, this is what we expect. So we expect to see your GlycanAge respond to chronic inflammation and chronic diseases that you have. And that's pretty much the point of the test. It's to give you that information of, okay, there is a risk of moving towards chronic disease because there is this continuous chronic inflammation happening in the body. And then finally, some of the other examples are things like pregnancy and breastfeeding. They will affect the GlycanAge. And again, we've done studies on this, so we do know this, and we would retest after reestablishing a cycle, and with perimenopause and menopause, which we've spoken about. And the last one there is just about extreme transport conditions. So this is one of the reasons that we say if a sample's been lost in the post for 2 weeks plus, we're just going to send you another test to repeat, because realistically that sample potentially been in an environment that would ruin the cadence of it. And then I guess one thing I would like to also discuss is the possibility to go deeper with GlycanAge. So glycans have a huge potential. If you're someone who knows about glycans very well and you have a lot of information about them, then you might already know this. But ultimately, because glycans are kind of like this language around our cells and our proteins, they give us huge amounts of information. And even though GlycanAge and Genos, which is the parent lab of GlycanAge, which has 10 years plus of research, $40 million in grants. Even though we have all of this research and information, there is still so much to be discovered. And one of the most recent papers that we published was looking at how glycans change with different diseases. And what we're seeing is that actually specific diseases have these, what I would call fingerprints of glycans. And if you have these particular patterns in people, you can kind of almost see before they develop disease that they might be moving in this direction. Now, we are not using this officially just yet. We're working on a program to develop this, so you can actually use the person's GlycanAge results to understand what diseases they're at highest risk of. But what we do have is this very useful what we call cheat sheet. And it shows you, it's a compilation of all the evidence we have at the moment when it comes to glycans. And what you can do is we have this sort of, I guess, table, which gives you information about which glycan means what. So we've named our glycans various names to help them be a bit more digestible and easy to understand, but actually their scientific names are G2, G0, and so on and so forth. And what we know is that certain diseases have a specific pattern of these glycans, so different levels of these glycans. And so if you have a client who has a GlycanAge result that is particularly unusual, what you can actually do is you can use this very handy tool, which has a series of diseases on the inside and the various different glycans on the outside. And you can actually track and see, okay, so this client had a very high glycan mature, but a very low glycan shield. And you can use that to understand that, okay, so this potentially means that this person is at risk of this disease. And this is compiled from a huge meta-analysis that was ultimately done to look at all the research within glycomics. And so, I like to be careful and not to say, this means that this person is going to develop this disease. That is not what it means. What it means is that they have a pattern of glycans that could be suggestive of this disease, and it could mean that they have a high risk of this disease. And so if you're going to pick interventions to use with that person, you can then give them information about what kind of conditions you are trying to avoid or move away from with the interventions you're using. I have a question, which is, do you at GlycanAge give diagnosis or treatment advice in specific cases? So the people who work at GlycanAge, in terms of the specialists who give consultations, will not be doing sort of prescriptions or giving disease-specific advice. The aim would be to give you information based on a health questionnaire to understand where you are, and give you information on how your GlycanAge results might be a cause of any of your, how your history or how your current lifestyle might be a cause of any of your deviations in your GlycanAge. So the information given is relatively not generic. We try to give actionable steps, but it's very much to start people in their journey. What we actually find is a lot of the people who come to us as a direct consumer, so people who are doing the test individually, the GlycanAge test will give them a lot of information. And what they typically want is they want to carry on that journey. They want to carry on this journey to understanding how they can improve their level of inflammation and their health level. And actually what we're finding is a lot of people ask us for recommendations to partners that we have, and this is something that we're starting to do with partners that we work with. If they're trusted partners and they've been using GlycanAge and they've demonstrated that their programs are able to reduce GlycanAge significantly, then we do try and recommend individuals who are doing the GlycanAge test who want a bit more guidance to some of those partners. I hope that answers your question, Douglas. So just in summary, the key things are GlycanAge is a responsive biological age test. And I think that is the most important thing. It responds to treatment, it responds to lifestyle, it demonstrates and shows if someone has a background level of inflammation happening, and it gives you information on the molecular level. The reason this is useful is because we know that disease doesn't happen, you're not well one day and sick the next. That disease process happens over time. And what we've typically lacked is a effective biomarker to track that change, because most of the things that we look at in traditional medicine are changing when a lot of the disease is already done. And so by looking at a molecular biomarker, we're seeing those changes happen a lot earlier than with traditional blood markers. The initial biological age that you can get with GlycanAge, as I mentioned, can sometimes be a bit surprising. So it's important to prime the patient and again, highlight the importance of retesting to assess the improvement and change over time. And the indexes are there to offer guidance to understand what inflammatory processes could be driving these deviations from their chronological age. And if you are a partner who's using GlycanAge in practice and you have questions or you have results that you're not sure about, we have a really helpful tool on the dashboard which allows you to book a call directly with one of our specialists or glycobiologists. These are typically people who've worked in the lab or who have PhDs in this area of science, who can give you some information to help you further understand those results. So if you are someone who's using GlycanAge and you get this unusual result and you're not sure about it, you can actually book a call with us to give you some further information on it and give you more specific advice about the cases. I'm going to open the floor to questions very quickly. Sorry, I do realize we are slightly over time, but I think we were a little bit late starting.
Can I ask a question?
Yeah, of course, please do.
Hi, thank you so much for your amazing presentation. I have 3 questions. You mentioned that NAD improved the result. Are you talking about the injection of NAD or taking precursors to increase the level? My second question, why don't you have the cardioglycan for men? And the third question, have you tried metformin to see if it would change the result or not?
So really fantastic questions. Regarding the NAD question that you asked, so we look specifically at Nuchido, which I believe is a precursor, which is, I believe is a precursor for NAD plus as opposed to direct IV NAD. But again, let me double check that to be sure. And so that's what we were looking at with that study. Your second question was about your third question was about metformin, and you were asking about studies that we've done on metformin. So yes, we actually have recently done a study for which we're waiting for the results, where we were looking at metformin and testosterone. So we're still awaiting those results, but they're due to be published sort of in the next couple of weeks, and so we will be sharing that with our sort of community. But what we do know is metformin is an interesting one. So put it this way, based on results and information that we have, what we understand is that if people are taking metformin and they don't have they're not pre-diabetic, they don't have any insulin insensitivity, we don't see a particular improvement in their GlycanAge. We don't see like a massive, it's pretty much equal about whether it's going to go up or down. And so this suggests to us that there is not a specific benefit of metformin when it comes to longevity and improving or reducing inflammation. And I know so many of you are probably on listening to this and you're like, no, that can't be true, because I know there's been a big split on is metformin beneficial or is it not. And what I would say is that the results that we've seen is that it's inconclusive. And I did have a client ask me this, and I always say this, disclaimer, this is just my opinion as opposed to fact. But what I would say is that if there is a patient who wants to start taking metformin, I think it's important that they understand that it's not a definite way to improve their longevity. It's not a definite way to improve their GlycanAge. But like with all medication decisions, it's about balancing risk benefit. And if someone is not having not significantly experiencing harm for metformin, because we do know metformin can cause a lot of symptoms, abdominal, stomach pain. We can see metabolic acidosis with metformin. But if people aren't experiencing this and they want to try it in order to understand if it could be beneficial for them, my personal view, and it is my personal view, is that it's not a bad idea to try it. But again, the results in terms of, is it really improving your inflammation and your GlycanAge and your longevity, it's inclusive. I hope that answers the question. I think you had a second I missed.
Yeah, the cardio glycan, how come you don't have it for men? And I also have one more question.
That's fine, no worries. So yes, the cardioglycan for men. So the issue with with glycans for men is that the story when it comes to cardiovascular risk is a lot more complicated for men. So in women, when we do the dry blood spot, the dry blood spots test that we do, so the GlycanAge card, there are certain glycans that we look at that are stable in that form, and so those glycans are indicative of female risk. However, when it comes to men, there are actually more glycans involved in the story, and so being able to collect all the information on those other glycans that affect cardiovascular risk in men is slightly more complicated and requires plasma. So we do it in research terms. So when we're doing research with scientific research with companies, we do it with the plasma, but we can't do it on the plasma blood spots that we have at the moment, and that's why we don't have it for men. It is something that we're working towards, and I think it's something that will be possible, but at this current moment we only have it for women.
Just to add
Thank you.
Just to add on what Simi said, there is an ongoing research with Harvard University that will help us develop the glycocardia report for men. So we are expecting this to be done in the next couple of months.
Thanks, Ori. Yeah.
Wonderful. My last question, there was a study showing that taking quercetin with the dasatinib, which is a chemotherapy medication for leukemia, can significantly decrease the biological age. Do you have any studies showing that it works or it doesn't work?
So with the study that you're referring to, do you know what they were using to measure the biological age?
I think it was methylation of DNA.
Methylation. So as far as I'm aware, and sorry, correct me if you think I'm wrong, but we don't have any studies specifically looking at denosumab and quercetin. Quercetin, I always say it wrong. Again, as I said, our aim is to kind of gather information on this, but with specific combination things like that, we don't have a huge amount of information on that. No, not particularly.
Do you use peptides, specific peptides like thymogen to improve the immune response and improve this test results?
Yeah, so one thing about GlycanAge is we try and look at, what's more important to us is understanding what things that are currently available can help clients, and peptides being one of them. So we are currently doing a study with a company called OneSkin, which is a cream that has peptide in it. I think it's peptide 14, I want to say, and we're looking at how that affects the GlycanAge. Again, these are the studies that are ongoing, and so we haven't released the results yet, but if you guys are interested in hearing about results like this, we are starting like a regular cadence newsletter that we'll be sending out with some of the results from the studies that we're getting, because we have a really big focus on using our test to actually understand what in this big world of longevity, where there are so many things that are really difficult to understand, is actually working, and using GlycanAge as a way to measure that. So we are doing a study looking at a product that has peptides in it, but the results haven't yet become available.
Yeah, I use OneSkin and I recommend it to my patients, and I'm interested to see the result, but I'm talking about other peptides that can improve the immune response and increase longevity, like BPC 157, injection of these peptides, because these are widely used in anti-aging medicine to improve longevity.
Okay. Sorry, I don't know. Are you aware of any? Sorry, because we have a lot of studies that happen. I mean, as I said, we're attached to a lab, and so there is a number of studies going on. And it's very difficult for me to sort of pull every single one out of my head. If you wouldn't mind, can you just put the interventions that you're specifically referring to in the chat, and let me speak to our team and get back to you on that?
Yeah, that would be ideal because we do have over 300 research publications. So yeah, I'm not aware of all of them as well.
Okay, yeah, I will. I mean, I'm driving. It's like 10 a.m. in California, but I will. If you send me the email address, I will definitely send those to you.
Yeah. Sorry, can I just confirm that do we have access to people's emails addresses on here?
Not through here, no. So I would just ask if you could email us instead at support@glycanage.com or partner@glycanage.com, either one or the other. I'll just drop them in the chat as well.
Okay.
So or partners at, and we'll get back to you.
Thank you.
And I would just like to say to everyone who is still on the call, so you know, as I said, we're really trying very hard, as you know, GlycanAge is still a growing team, but we are trying very hard to direct some of the research we're doing towards things that are becoming popular, or that there's a lack of evidence on, but are being used significantly by the population. So it is really actually really useful and interesting to hear from you guys. What are the things that are out there in practice? Of course, we do our own research, and we do make sure we try and look at those key things, but actually there are so many things in this space that are being used, and so if you guys do have questions about, you know, do we have a study on this or that, you can email us at partners@glycanage.com, and we typically will be able to get back to you. So please do share with us, because then it kind of helps us to direct where we want to do research and studies as well.
Thank you so much. I appreciate your time.
You're very welcome. So I'm gonna move over to, so we have another Q&A after this for anyone who does have any further questions. But thank you everyone for your time. I really hope that was useful. As I mentioned, we will look to send out the slides that I've presented today, especially for people who are using GlycanAge. And if you have any specific questions, or you have any specific clients that you've been working with that maybe you're struggling to interpret the results, as I mentioned, please do use the dashboard and book a call with us, because we can talk you through it. Thanks, everyone. Thanks, Patricia.